For this lab, we're working on the internal pelvis and genitalia, and for this particular video, we're looking at the pony specimen. So here we're looking from the lateral side at the pony, and we're going to turn it over and look inside the pelvis. So we're going to start on the internal pelvis, where we ended on the last lab. So here, and just remember that I have a male specimen, so some of these will be specific to the male, and so I'll try and point those out as I go along. And inside the pelvis, we started on the last lab with the external iliac arteries. So external iliac is here, and external iliac is here, coming off of that aorta. So now today we're going to move on to the internal iliac arteries. So you can see internal iliac arteries are here and here. So again, you'll have a left and a right. And so we're going to follow the internal iliac artery, and we'll do that on both sides. But first of all, you're going to cut your pelvis so that you'll be able to see things for when we get to the genitalia and follow these arteries. So I'm just going to talk a little bit about that, and we're actually going to turn it over to the left side of the pony. And on the left side, recall that your limb has been removed, so you don't have a limb in the way on this side, but you're going to actually reflect or remove part of your pelvis. So you're going to do that by cutting with a bone saw, and you're going to cut just ventral here. So you're going to make a cut just ventral to the ilium, and then you're going to cut on the pelvic symphysis. So you have to kind of make a path, I guess I would say. So you want to take out some of this muscle that's on the ventral midline here, and you're going to remove some of that muscle so you can see this ventral midline of the pelvis, so the pelvic symphysis. And you're going to actually just push all of the reproductive parts over to the right side so they stay with the right limb. So you're going to just kind of push everything over to the right, take out some of that muscle, use the bone saw, and you're going to cut all the way through that pelvic symphysis. So from here all the way back to here. So that whole thing needs to be cut through, and then you're going to make this cut ventral to the ilium here, and you're actually going to just remove this whole piece of pelvis. And so I'm leaving mine attached. If you can leave it attached, I would recommend doing that so that you can see some of the arteries and things still going where they should be going. But if you don't, you can just remove it and take it off completely. So you're taking off that part of the pelvis. And now we'll go back inside the pelvis, and I'll talk a little bit more about that internal iliac artery and where it's going. So you want to try to follow these arteries on both left and right sides. On the left side, some of them you won't have the whole artery, you'll just have part of it because that side has been cut away. But on the right side, you should have the whole artery, and you should be able to find the whole thing. So on the left side, we're going to start with the left internal iliac artery. So here we have left internal iliac artery, and that is going to branch into two parts. So you'll have an internal pudendal, which will be this branch here. So I'm going to put that in the forceps, and then you can see this other part is going to be your caudal gluteal artery. So it's very large and very thick. So this is all caudal gluteal here coming off. So again, your internal iliac is going to break into two parts. So your internal iliac is only this short little part here. So internal iliac gives off internal pudendal and caudal gluteal. Now the internal pudendal, you're going to follow that and look for the branches that come off of internal pudendal. And the first one is going to be the umbilical artery. And it won't look like an artery. It will kind of look like a nerve. So you want to look for that, and that's the umbilical artery that's going toward the bladder. So the urinary bladder is here. So you can see urinary bladder here, and we have that umbilical artery right there, going right into that bladder. So that's the umbilical artery. Then the next one you want to look for off of internal pudendal is going to be kind of hard to see, so I'll try and turn it a little bit here. So internal pudendal gave off the umbilical, which I'm holding here with my finger, and then continues on, and it's going to give off a urogenital. And so you can see that here, and I'm going to turn it to the lateral side in just a moment to get a better look at that. But urogenital will come off, so in particular in the male, it's going to be called a prostatic artery. In the female, it would be different, so you want to make sure you look at that. And then you have the continuation of internal pudendal. So that's going to continue. So I'm going to turn this to the lateral side so we can look at it from the left view where we cut away that pelvis. All right, so here in this view, we've removed this part of the pelvis, and you can look and see the internal pudendal artery is right here coming out. And so we're looking at internal pudendal here, giving off that urogenital branch. So in the male, again, it's prostatic. In the female, it'll be vaginal. And so prostatic here, and then internal pudendal will continue on. So that's going out to the perineum region out here. So that's then going outside of the pelvis. So if I put this back, you can see how it's coming out of the pelvis and then going into that perineum. So that's internal pudendal artery. Then we'll go back inside the pelvis and look at the caudal gluteal. All right, inside the pelvis, you have all of this is going to be caudal gluteal artery. And then caudal gluteal artery will give off several branches, but we're going to look specifically at the cranial gluteal and then the continuation of where caudal gluteal goes. So cranial gluteal is going to come off, and it's this very large branch here coming off of caudal gluteal. And so cranial gluteal is very large, going out to the lateral side, and we'll look at that in just a moment. And then caudal gluteal is continuing on here. So with the cranial gluteal, I'm going to put my forceps around it and then flip it over to the other side. So here you can see the forceps, and so those are surrounding that cranial gluteal artery. So you should have found that before coming out here on the lateral side. So that's all cranial gluteal. But your cranial gluteal is also going to give off a special artery in the horse, and that's called the obturator artery. So you can see that here. So the obturator artery is coming off right here, and that's going to go through the obturator foramen of the pelvis. So that's what I'm holding in my hand, is that hemipelvis, that part of the pelvis we took off. So you have obturator artery here, and then disappearing underneath this internal obturator muscle. So internal obturator muscle there, covering that obturator foramen, and the obturator artery is going through that foramen. You also have an obturator nerve going through the foramen as well. So here you have obturator nerve running right alongside your obturator artery, going through the obturator foramen. Then the continuation of the caudal gluteal is also seen from the lateral side. And you have your sacrosciatic ligament here, and I've cut through that so I could see where that caudal gluteal artery was coming out. So this is the continuation of caudal gluteal coming out here. So caudal gluteal will continue out laterally, and it actually just punches right through that sacrosciatic ligament. So caudal gluteal there, cranial gluteal was here. The other thing I want to point out is the sciatic nerve. So you have just a stump of the sciatic nerve on this side that you can see here. But you also want to see where it's coming from inside the pelvis, so internally. So when you go back into the pelvis, you want to dig dorsally, kind of by where your caudal gluteal artery is. And I'll just surround it here. So between the end of my probe and the end of the forceps, you can see the sciatic nerve is the root of the sciatic nerve there coming out. Now we'll do these same arteries on the other side, on the right side, so I'll just walk through those quickly. On the right side, internally, you would have the internal iliac artery. Then you would have your internal pudendal. And your caudal gluteal. So caudal gluteal here, internal pudendal here. Then your internal pudendal is the one that gives off your umbilical that doesn't look like an artery. So umbilical artery here going to the bladder again, which is here. So bladder, umbilical artery. Internal pudendal will continue on. And hopefully we can maybe see a little bit of that from the other side that we moved the pelvis so we can see that. So it's a little bit different view since we're looking at the right side and we're looking at it through the left side, but you can see that internal pudendal artery would be here. So internal pudendal artery here, giving off that urogenital. So in this one it would be prostatic since it's a male. And then internal pudendal will then continue on again and come out caudally in the perineum. Then your caudal gluteal will do the same thing as it did on the other side. And you'll have caudal gluteal giving off cranial gluteal. So here I've cut some veins that were in the way, and you can feel free to do that if you need to see what you need to see. And so here we have caudal gluteal coming off. We have cranial gluteal, if I can get that vein out of the way. Cranial gluteal would be here, going through to the lateral side. Caudal gluteal continues on, and we can see those again on the lateral side, on the right side this time. So here you can see that cranial gluteal coming out on the right side, caudal gluteal coming through that sacrosciatic ligament here. And then you also have your sciatic nerve right here. And from internally, the sciatic nerve root may be easier to see on this side possibly. And maybe not. I think we may have to just take a closer look at that internal pelvis to see that sciatic nerve so I can point that out.